Welcome to MedMythBusters Norovirus. I'm Rachel Deere with DKB Med. I'd like to introduce our esteemed faculty, Dr. Paul Auwaerter, Clinical Director in the Division of Infectious Diseases and Sherilyn and Ken Fisher Professor of Medicine at the Fisher Center for Environmental Infectious Diseases at the Johns Hopkins University School of Medicine. Before I turn it over to Dr. Auwaerter, a few housekeeping items. Here are Dr. Auwaerter's disclosures. This program is brought to you through the generous support of DKB Med and the Institute for Johns Hopkins Nursing. Our learning objective is describe the routes of transmission of norovirus. And now, Dr. Auwaerter.
Hi, I'm Dr. Paul Auwaerter. Thanks for joining MedMythBusters, and today we're going to tackle some potential myths regarding norovirus. Our first myth: is norovirus a relatively tame virus that everyone gets? That is a false statement. So let's go into the epidemiology of this virus, which was formerly called the Norwalk agent and also had the reputation of being called winter vomiting disease. But it really is a year-round problem that's the leading cause of acute gastroenteritis in all age groups in our country, and is nearly responsible for 60% of any foodborne illness. So this really tops Salmonella and Campylobacter. There are nearly 1,000 deaths from this norovirus due to acute dehydration and illness, and it can affect people especially at the extremes of age, so young children and the elderly. Over 100,000 hospitalizations, many emergency room visits, and millions of outpatient visits. And importantly, this is a norovirus that sort of adapts to the human population's existing immunity. And from time to time, new viral strains emerge for which we lack immunity and therefore can acquire it again. So a very successful virus. And indeed, this year, you can see the number of outbreaks of norovirus have really topped previous years. And it remains a cause of both sporadic gastroenteritis as well as outbreak-related causes. And of course, many outbreaks are probably never detected and recorded. So this gives you a little bit of an additional flavor over the past few months. And again, hewing to its old term of winter vomiting disease, you can see this really does pick up quite a bit during the fall to winter time. And this, unfortunately, is commensurate with the respiratory seasonal virus problems as well. So sort of a double whammy. And I've had a number of patients in my own clinics call with complaints not only of COVID and influenza, but then with acute gastroenteritis and in all likelihood driven by this virus. Now, the second myth to consider is norovirus generally lasts 4 to 7 days. That's incorrect. And this is something where most people do get better within a day or two. And interestingly, people can have just pure nausea, they can have pure diarrhea, or they can have both, which unfortunately is the worst of both worlds, with some abdominal pain and generally mild systemic symptoms like fever, headache, and so on. Now, where people get into trouble is if they don't keep up with the hydration status, and especially if they're particularly fragile, which of course would be the youngest children, or perhaps older people where they're already at baseline chronic dehydration. They really get into trouble, especially if they have some heart disease or other issues. And that's something to be very wary of. The only treatment really is supportive care. There's no antiviral. And in fact, I'm not sure it'd even be worthwhile since the virus seems to run its course usually within a day or two, or at most 3 days. Now, the third myth is norovirus is only transmitted by people that have symptoms such as nausea, vomiting, or diarrhea. This is another falsehood. This virus is extraordinarily contagious and it is successful because it can be transmitted by a number of different ways. It can be in direct contact with somebody shedding the virus, or perhaps foods or drinks could be contaminated with the virus. This could be shellfish, this could be fruits and vegetables, or someone who's preparing foods. Or it can actually be picked up as a fomite, and it is a relatively hardy virus that can live up to 10 to 14 days on surfaces if there's appropriate conditions as well. So this really can lead to outbreak potentials, and it's run through hospitals, nursing homes. You've probably heard news stories about cruise ships that have just had really rapid spread of the virus, which interferes with people's vacations and happiness. So this is something to be truly aware of and be cautious of if you suspect someone has this. And what we might advise our patients is that to have really very careful hand hygiene, especially during this time of the year, if you do have young children, by changing diapers, or if you're caring for people that are ill with gastroenteritis symptoms. But as I've mentioned, people who are asymptomatic can shed it as well, or you can pick it up from other aspects, not just direct care. It could be foods or surfaces. So this is where you'd really like to use wipe down issues with disinfectants or Purell and so on. And you can see on the right-hand side, the Centers for Disease Control has the usual kind of nostrums in terms of also cooking to appropriate temperatures and washing your fruits and veggies, as well as if somebody is sick in the home, using bleach or other antiviral disinfectants to take care of things and launder infected clothing in hot water. So thank you for spending a few minutes thinking about norovirus. I certainly hope you and your patients don't acquire it this season or down the road, but if you do, some helpful aspects that may help in terms of preventing transmission to others. Thanks so much for listening.
Thank you to Dr. Auwaerter for busting those myths about norovirus. Thank you for watching. If you'd like to claim ANCC credit, please click the Claim Credit button to take the evaluation. Your thoughts and comments are important and help us develop additional education for MedMythBusters. I'm Rachel Deere with DKB Med.